Good morning, OSU medical students. We're the surgery team that's going to be demonstrating some videos for you today. We each introduce ourselves. I'm Nate Roberts. I'm the core coordinator for third-year students.
Hi, I'm Katie Metler. I'm one of the first-year intern surgery residents.
Hi, I'm Jared Lepley. I'm one of the general surgery chiefs about to graduate.
And so today we're going to walk you through a couple of steps to orient you to a mock OR, hopefully to put some of your concerns or apprehensions at ease. We want you to have fun in your surgery rotations, and part of fun is being safe. So we want you to put on, we're going to demonstrate here shortly how to put on protective gear prior to scrubbing for a surgical case. And so Dr. Metler already has her mask on. That's the first step. And then she will also put on a surgical cap. They make a couple different versions of these. She made that look easy. If you have longer hair, it's good to tuck that all inside the cap. And then there are also shoe covers. There's a chair over there if you don't want to slide it over for me. Those will stretch out some. They make longer ones too if you're going to be a case that maybe have a little more blood or fluid loss. And eye protection. And so all this is setting up for safety prior to doing her surgical scrub. When she goes to do her scrub, she'll be sterile, so you want to have all this stuff adorned prior to scrubbing. All right, so for the next step, we're going to demonstrate how to surgically scrub prior to start of a case. So there are stacks of scrubs that you'll see that have iodine in them or CHG or different versions of cleaners for your hands. Prior to opening those, you want to make sure you have all jewelry off, watches, anything like that. And then obviously we already adorned our caps, mask, and eye protection. And so Dr. Metler is going to walk you through this portion of it, how to sanitize, sterilize your hands. And Dr. Lepley is going to help to narrate some as well.
Okay, so in each packet there's a scrub brush. Dr. Metler's opening up there, and there's also a little fingernail pick. So typically you start the scrub by cleaning your fingernails. This is just to get any dirt, things like that out from underneath them. Once you're done using that little pick, you can discard it and just toss it away. The next step is essentially to get your hands and forearms totally soapy. So the cleanliness of the scrub is related to the length of time the soap is on you, in addition to how well you actually physically scrub. So typically start each scrub by just getting my hands and my forearms nice and soapy, and then I start the actual scrub portion. The idea behind scrubbing is you want to start with one place and move away, and not return to that area, so you're not bringing dirt from one area back. So the dirtiest parts of your hands are underneath your nails and between your digits. So that's where we spend the most time scrubbing, and we do this in a systematic way. Everybody can have their own system. The way that most people do it is start on the sides, work around, and then get the tops and bottoms as you go. And Dr. Metler's showing that very well there. And once you get that hand done, then you can switch over to the other hand. And again, same process, sides of the fingers, in between the digits, under the nails, top and bottom of each finger, working systematically through. Once you get all of your hands done, then it's okay to work on down to your forearms. Really, for a scrub, you just need to the elbow. There's no need to go up any higher. But again, the idea would be not to return back to the hands after moving away from them.
The overall length of a surgical scrub will be between 3 to 5 minutes, depending on the facility. Oftentimes, somewhere close to the sink, there'll be a clock or even a timer on it that'll tell you how long you've been scrubbing. And once you activate the sink, the automatic timer sometimes will start on those more updated versions of sinks. As Dr. Lepley described, kind of from distal, so fingers, then working proximal eventually to go to your elbows. The positioning matters, so if you ever inadvertently touch the sink or something that's not clean, you basically stop and start over. And then having your body oriented so that your elbows are away from the rest of your body. You don't want your elbow to inadvertently touch your shirt or your shirt sleeve. And so once you've done your 3 to 5 minute scrub, then you'll discard the sponge and then rinse off. And the rinsing can be a challenging part at first as well, where again you'll kind of rinse your hands first, so distal, and then work proximal up to your elbows, this kind of maneuver. Dr. Left will show you a little swim dance, but yeah, a little slow-mo matrix movement.
And the idea is just so that you're not getting anything on your forearms down to your hands. Your hands are obviously the most important part that you want to keep clean in the operating room.
And then standing with your arms out, elbows up, and getting ready to walk into the operating room. If you did it this way, you'd walk in wet and you'd wait for a towel from the scrub tech who is sterile, which will hand you a sterile towel to be able to dry yourself off. Some people alternatively would dry themselves off at this point with non-sterile paper towels and then use the other type of antiseptic, whether it be a foam version, or here we have Avogard. I'm a fan of that, but not everybody uses it. So we're gonna demonstrate next how to dry off once your arms are wet. For the next portion of this, we're going to demonstrate how to sterilely open your gown and gloves when you're a student. Typically you're required to get the appropriate size gown and gloves for yourself and bring them into the operating room. And you want to be able to open these sterilely. Sometimes you'll hand them to a scrub tech, and I'm going to be the scrub tech in this scenario. Alternatively, you may place them on the sterile table, but you for sure don't want to make everything contaminated on that table. So Dr. Mettler is going to demonstrate, Dr. Leftley is going to help narrate.
Okay, so these are all, there's different packets, but they all are pretty much the same. So within this packet, Dr. Mettler's open, you tear the top off, and then the gown itself is wrapped in this paper. The inside of the paper is sterile. Obviously, where you're touching the outside is not sterile. So there's this little triangle lip here. The way you do that, the way you open this is you put your thumb underneath that, and then you peel the paper, sort of like peeling an orange. And as you're doing it, you're catching each piece of each corner of that that she's showing here.
Almost like peeling back petals of a flower. And you grasp them behind with your hand that's stationary so you can expose the sterile inside of it without contaminating the gown itself.
And that's what she's showing here. You're just kind of peeling and catching each of those corners until the gown itself is exposed. And so at this point she's holding it properly. The inside of this is sterile, and that would be grabbed by the scrub tech or
so
tossed.
She can either hand that to me and then I will place it on the table, get ready to place on her when she's then washed her hands, or she can place it on the table. And to do that, you kind of do a little bit of a toss and drop. That's an easier way than trying to place it and inadvertently contaminating the sterile field.
I would highly recommend, though, handing it to somebody, especially when you first start, because the scrub techs will be very upset if you inadvertently touch the table and everything's unsterile.
And you don't want to cover up the scrub tech's gown either, because they're usually the first ones to scrub in. So you don't want to put it on top of theirs. You may not know which one's theirs.
So the next thing is to open up your gloves. It's a very similar process. Inside the package is sterile, the outside is obviously not. So you peel it open, which Dr. Mettler is showing here. And so again, this package here is sterile. So then you would hand that to your scrub tech.
So I can sterilely grasp it and pull it out, or she can gently place it on the table.
And the way you do this is you just continue to kind of open it and let it fall out. Again, you don't want to touch the table and contaminate the table. So that's how you do that.
Okay. For the next video, we're going to demonstrate how to sterilely dry off your hands if you come into the operating room ready to gown and glove and your hands are wet. And so I'm being the scrub tech, Dr. Lepley is the narrator, Dr. Mettler is the surgeon or medical student. And so she's coming in with her arms wet, she's walking in appropriately with her arms out, away from her body, hands up. And so any water that's going to drip is going to drip off her, not onto her, and will drop off her elbow. She will place one hand out, and I will place this sterile towel in her hand, and she's going to demonstrate how to dry off her hands.
So the idea behind this is you don't want to touch any part of the towel that you use again. So what she's doing here is she's using one side of the towel to work her way down her arm, and then she's going to flip the towel over with her now dry hand and repeat the same procedure on the other hand. Again, working from the hand to the elbow. And when you're done, you just drop the towel. Don't worry about setting it anywhere in particular.
The circulator in the room may already have gloves on, non-sterile gloves, and grasp that, or you drop it on the floor and they'll pick it up. But definitely try not to touch yourself or your shirt or your pants with that towel as you're drying yourself off. And then she again will stand here with her arms out, and now she's ready to be gowned. For the next step, we're actually going to show a single person putting on their own gown and their own gloves. And so Dr. Mettler is going to demonstrate that, and her and Dr. Lepley are going to narrate it. And so she's already sterile at this point, and now she's coming in and going to put her own gown on.
So this is typically done by grasping the gown from the backside with your right hand you can see this little flap here on the inside of the gown. That's actually the beginning of where you put your arms, as those are the sleeves. And so by grasping the back, you start to put each hand into those little flaps, which is each little sleeve, and then you open up the gown, let it all fall out, and stick your arms through. That's kind of the general motion of it. Now, you're sterile up to the cuff, so you don't want to stick your hands through the cuff. So you see she's kind of balling her fist there, right there. And then with kind of her balled fist, she's going to start to open up her gloves. This is done by opening them up like a book. If you'll hold the gloves to show them. So the thumb is right there on this side, so the glove is currently like this. And the way she's going to do this to gown herself or to glove herself sterilely is to flip that so that the thumb is against her wrist, and then with her hand she's going to tuck that into the beginning opening of the glove, grasp it, and pull the whole thing over. And it's a lot easier to say than do. And then once the glove is over your hand, you can pull it back and work your fingers out into each of the little finger spots with the glove. Again, much easier to say than do. And then once you have one glove on, it's way easier to put the second glove on. So you basically repeat the same procedure with the second glove. So again, putting the thumb against your wrist, grabbing that first little lip she's showing right there, and then pulling the whole thing over. But now you have the whole hand to use.
Perfect. And the back of her gown is not sterile, so it's Velcro, and I strapped that for her. And the gown in the front will have two tabs a tab to pull with two strings on it, and so she will hold on to one tab, hold on to the tab and pull one string out, and then she'll do a spin move, grasp the other strand and not the tab, and then she'll tie it.
Okay, so she's opening up her gloves again. She doesn't have her hands exposed at this point, so you open it up like a book, and then open up each page. Right, so starting, she'll grab her. Conventionally, you start with your right glove, so you grab the glove and put the thumb up against your forearm. You grab that little lip on the inside with your right hand, and then with your left hand, you use that to pull the whole glove over your right hand. And you just kind of work your right hand into the glove, kind of adjusting the sleeve and adjusting your fingers as necessary. And then now once you have that one glove on, you repeat the same process with the left hand. It's a little easier because you have a full hand to use. So again, put the thumb up against your wrist there, hook that little first lip, and pull the whole thing over. And then kind of work your hand out, adjusting your sleeve and glove as necessary.
So for this video, we're demonstrating that Katie is the surgeon or medical student, Dr. Lepley is the scrub tech, and I'm the circulator. And she's already dried her hands. She's sterile. She's coming in, and Dr. Lepley is going to sterilely gown and glove her. So Dr. Mettler is going to walk in, extend her arms. Dr. Lepley is going to open up the gown and gloves. She will gently insert her arms into the arm sleeves, and Dr. Lepley will gently help to facilitate putting the gown over her shoulders. Then she will keep her hands inside the sleeves. She can encourage part of her hand out of the cuff. She will pull out the glove with her left hand while Dr. Lepley helps her to insert her right hand into the glove. And you can line up the finger and thumb holes, makes it pretty easy, and securely pull it down. It ends up being about mid-forearm. She can repeat the process with her other hand. Again, pulling out with the glove, inserting her hand in, and then standing ready. Now the circulator in the room will help to Velcro the back of her gown, which is considered to be non-sterile. There's also a tie back here that I'll tie as well. Again, this portion is non-sterile. And the gown functions to where it overlaps in part. In order to make that part work, she will, there's a tab with 2 strands on it. She will pull the tab in one strand away with her right hand, and with her left hand hold the other strand. Hand the tab to the scrub tech, make a spin move, and now both strands are sterile and she can tie those.
At this point, you're sterile from your nipples to your belly button, so you basically just stand like this, not like this with your arms down.
But keep your arms up above that level to stay sterile. Video, we're going to demonstrate how to actually take the gown off. And so there's a little bit of an easier way to do it. If you figure out usually on your left abdomen where you have the tie that you made, you can kind of grasp in that loop and then break it, and then pull from above your upper body to break the Velcro from your back, and then you can pull either up or out, and it'll break the tie that the circulator tied, and then you can just work the gown and gloves off your hands. You can do this in a way where even if you were saturated on the outside in your gown and gloves with blood and body fluids, you would not get any on yourself by the way you remove it, but kind of folding it from outside, from inside to out. And so then you wrap it up and dispose of it in the nearest acceptable garbage can.
Okay, so this is just some general tips and tricks to be successful in the OR. Some things that we've kind of picked up along the way and see that students commonly run into and issues that they have. So the most important thing you do when you walk into a room is introduce yourself to the resident, the attending, the scrub tech, and the nurse, and then write your name on the board. Almost every single OR board has a whiteboard with a little marker that you can write your name, just so that they know who you are, so they can document that appropriately.
After which you can ask the attending or the resident if it's okay that you join them in the case. And then you can ask the circulator nurse and the scrub tech if it's okay that you get your own gown and glove. And then that's when you can come in with your gown and glove and open it sterilely for them. And then following that, you can go scrub and then come back to the operating room and gown and glove sterilely with the scrub tech.
Things will be set up in the operating room similar to what's set up here. With near the head of the bed will be anesthesia, and the patient will be draped, and there'll be a Mayo stand shown here, which will have some working instruments that need to be readily accessed. And then back here we call this a back table, and anything blue is sterile. So if you're sterile, you can touch it. If you're not, you shouldn't. There's a kick bucket that we often use to put our sponges in, so those can be appropriately counted at the end of the case and make sure that's accurate. Once you've adorned your sterile attire, you should be comfortable walking up to the table, and you can stand right up to the patient. You can leave a little bit of distance between yourself, but pretty much belly up to the table, and you can place your arms on the patient. Once you're sterile, if you're sterile, you can touch anything that's blue, so you don't need to stand there awkwardly with your hands, hold yourself, not apprehensive about where you can place your hands. It's okay. The patient's sterile, you're sterile, just put your hands down. Just kind of be ready to help. That you may be asked to suction, you may be asked to use a sponge, you may be asked to suture at some point, so you need to be engaged with what's going on and be ready to facilitate the operating surgeon or resident.
And after the case is done, one of the most important things a student can do is to help move the patient back onto their hospital bed and accompany that patient back to the post-procedure recovery room. Another thing that students can do that's very helpful is to pay attention to the I's and O's, or the ins and outs of the case. So at the end of the case, we'll ask, well, what was the blood loss, what were the fluids given, the amount of fluids given, and what was the urine output, and that's very helpful for students to do. Some places will have a little bit of paperwork that students can help fill out as well with that information. And of course, you can ask your resident or attending if you don't know what exactly the procedure was or exactly what happened, but that you can help out that way by filling that paperwork out.
And if there's something that's unclear or you have a question about, feel free to ask. We've all been in the student's shoes before, and we've all had a first time scrubbing into a case, so feel free to ask.
Thank you so much for your attention today. We hope you enjoy your core surgery rotation with OSU.